Peer-to-peer accountability is way stronger than manager-employee accountability. And if they all understand they're working for a group, like we have a community here, we're all trying to accomplish this mission together, your productivity will through the roof.
Welcome to another episode of the Physician Growth Accelerator, a show where we break down your medical practice systems into vitals, give you the tools to diagnose root cause of what may be holding you back, and prescribe what to do about it. I'm your host, Zed Williamson, and I believe that every system is perfectly designed to get the result it gets. The freedom that exists in that understanding is if we don't like the outcome, that's okay. We just got to go find out where in the system we need to do the tweaks, make the tweaks, and we can control our own destiny. And I'm really excited today because we have a special guest, Dr. Caleb Masterson of Center ENT Alabama, and founder of Provider Autonomy. And the reason I invited him on the podcast is I witnessed him talk about how he structured his practice from the podium at Otoform in Alexandria, Virginia. And it really connected with some of the beliefs that we have at Physician Growth Accelerator. And I was just absolutely excited to hear someone talk about something they've already created and they're already experiencing the benefit. So with that, Caleb, thank you so much for joining us today.
My pleasure. Thanks for having me, Zed.
Absolutely. So if you don't mind, just give the audience a little history of you entering private practice, what you witnessed, and the things that you decided to do on purpose.
Yeah, a lot of the reason going into private practice for me personally was spurred by a lot of the issues you just kind of went through in your intro there. All through my medical training, medical school residency, I had a wonderful surgical training, unbelievable experiences in patient care. But the cultures I witnessed in the offices I worked in, I just was under the belief and suspicion that it didn't have to be this way. And so when I ventured out into private practice, the primary initiative that I had outside of providing great medical care was a great personal environment, a place that I wanted to go to work to every day. The people that I worked with, I enjoyed working with. And what I quickly realized was it was a lot harder to build that than I thought it was. And that coming out of medical training, I was under the impression that, I had all of the leadership skills I needed, but when I stepped into that space, there was a lot of learning to do. And as we started to learn those systems and learn to put into place what cultural aspects we wanted to see, it became evident and really clear to me that I was just as passionate about finding meaning and connecting with patients as I was finding meaning in connecting with employees and building a great culture and a great team.
Yeah, I love that. There, you said so many things there that I align with. The Physician Growth Accelerator exists because we believe that people don't have to live the way they're living, and there's so many people in existence, in practice, in business, wherever it is, and they're kind of on cruise control. They wake up, they do the same thing, they're frustrated with the same things, they go to bed, they look forward to the weekend, and then Sunday night they're going, oh, great, here we go again.
Right.
And I am a huge fan of just being absolutely fired up that it's Sunday night and that the next day is a day that I get to go have the opportunity to do all the things you just said, connect and grow and drive. And it's just, it's so good to hear you say that. What was some of the road bumps or roadblocks that you ran into in the beginning where that really showed you that, man, I've got to put some thought and purpose into this?
Yeah. So I was under the impression that when I came out of training, just because of the letters that followed my name, that I was a doctor, that people would just give me respect, that they would follow me missionally, and they would just understand the vision that I had for the practice. I started my practice in 2019. And 6 months into practice, COVID happened. So we totally got shut down. We were seeing much less than we thought we would see. And I had a team of about 4 or 5 people, and we kind of sat around the table going through the schedule every day, making sure to isolate the patients that needed to be seen. And I kind of looked at them, I said, okay, what else could we do to bring us closer together as a team? We started to open up some leadership books, and very quickly we realized we weren't running the practice the way that excellent businesses that we would consider cultural cornerstones of how to run great businesses or run. And so we started to implement some of those ideologies in the practice, mission, vision, and values as it relates to patient care and what we want to see our team members become. And when you do that, it inspires people, but it also identifies in people on the team that don't have that mission, that don't have those values. And so right off the bat, you have to make a decision as a leader of your practice that this is what I'm about, and be willing to deal with the consequences and the outcomes that it's going to take to get there.
Yeah. It's I had an experience in my business where I asked a question of someone and they said, well, if we had higher standards, yes. And
Right.
I went,
Right.
oh man, okay, I have missed the
That's on
mark.
me.
Yeah,
Right.
yeah.
Yeah. So
And
I think go ahead. When we started, I was always intent personally. I knew what my values were and I knew where I wanted the business to go. And I just thought through osmosis that that vision and values would just be communicated to my people. But I'm a human being. I don't communicate perfectly. And obviously, I don't set vision perfectly. And so, if I'm not intentional and I'm not making those things very, very clear, people don't just naturally, we don't just wake up one day and like, oh my gosh, the culture's great. No, you have to be intentional about that. And once you decide that's what you want, some of the people are going to be really fired up about that. And some of the people are going to be like, hey, that's just not for me. And it's intimidating at first because now you're faced with staffing pressures and decisions. But if I can encourage the audience just a little bit, if you stay on that road, it may be difficult at first, but the outcomes in the future are much better than what you're currently dealing with.
yeah, it's, our brain plays tricks on us. Our
Right.
brain is really good at surviving today, not so good at thinking about the best survival for ourselves weeks, years, and decades into the future. And so what we can do is we can look at staff specifically and say,
Hmm.
gosh, I really need this person, even though they're not a good fit for the organization. And that's your brain playing a trick on you.
Right.
And it's making you think that that is more urgent than it really is. Am I off base with that kind of explanation of what you witnessed?
No, absolutely. I mean, so more often than not, we're willing to sacrifice for what we want in the future for what we want right now. And when we make that sacrifice because we think, if I just hire this person, or if I just buy this piece of equipment, or I just grab this consultant, they're going to fix my problem. And the truth is, you have the opportunity as the de facto leader of your organization. And again, as like we say with provider autonomy, by being a nurse practitioner, by being a PA, by being a physician, whatever that medical provider in that situation, they're a leader. And so setting vision is, hey, this is how many procedures, or this is how many patients, or this is the kind of care I want to provide. Being really clear about that to the staff really gets staff aligned underneath that vision. And then when I'm hiring somebody or I'm bringing somebody on board, I'm not starting with, hey, I need you to accomplish ABC. I'm starting with, we are accomplishing ABC. Would you like to join us in that mission?
Yeah,
Would you feel like you want to be part of that? And if they get excited about it, it's like, great, fantastic. Come and join us.
yeah. Do you want to merge into our lane?
Right.
As opposed
Exactly.
to, wait, so you're saying you don't just tell the staff one time and then everything's perfect?
Actually, yeah, it's fantastic. I just say it one time and then I'm done. And then I never have to remind anybody. No, a lot of times I mentally remind myself that I'm not always the CEO. I'm like the CRO. I'm the chief reminding officer.
Yeah,
A lot of times we say to ourselves, until I say it 7 times, I can't really expect anybody on the team to really adopt it. And that's because honestly, a lot of times people coming into a medical space or a medical practice have been disenfranchised by leaders in the past. So maybe the administrator or the leader that they've been working under have come now into your practice and you're gung ho and you want to make it work and you have this beautiful vision, but they come in with this idea. Well, I've heard this before. And yeah, they read this book, and then we all got together in the break room, and they pitched this big vision. I never heard anything about it again.
yeah,
And so now you've got to start to piece back together the trust that that other provider or that other healthcare official or administrator kind of started to peel apart, and knowing that I'm already under the impression that I have to continue to say this over and over and over again is going to give me more grace for the people I'm leading. Because I know my role is to say, hey, right here, we're together. this is where we're going. We're not going over there. We're not going over there. We're going right here. I'm okay to remind you of that because I know it's my job.
Yeah, that's great. There's some foundational behavioral things that really align with this. We really enjoy taking a neuroscience approach to systems in business because every system has a human attached, and every human has
Amen.
this brain that we're dealing with.
Right.
And two things came to mind from what you said. When you're creating this culture and you're setting these standards and you bring clarity, it helps the people who want to be part of that mission realize it, and then they are energized by working harder towards it. And
Amen.
if we just take evolution, the idea of evolution into play, if you think back thousands of years, the easiest way to basically make sure that you would die as a human is to be ostracized by your community.
Yep.
And that still affects us today. So if you
Right.
have zero clarity in your organization, and then there's any kind of conflict between employees, the
Mm-hmm.
response or reaction is typically very negative because they don't understand the lay of the land. So they're
Right.
always in the am I about to be ostracized from this community? When
Right.
you bring in clarity, someone gets to say, this community isn't for me. That's very
Right.
different. So
Right.
that's really powerful. Have you witnessed that in either onboarding new staff, people who've moved on?
Yeah, in both. Um, I'll answer. So in the latter part of that, I've had some post mission, vision, and values, really beautiful transitions away from the business or the practice where an employee will come to us and say, hey, I love what you guys are doing here. It's just not for me. I don't have the capacity to meet these standards right now. I hope one day I do. And we say, we're so thankful for you being honest about that. Let's get you a good recommendation. Let's get you another placement somewhere else where we leave on great terms. We don't burn a bridge. And when things are different later in the future, maybe we can rejoin forces. You said a lot of things right there from a community standpoint that are really important. And I tell all of our managers, our responsibility as employers and leaders to our people, if we have to give them three things. Number one, we have to give all of our people autonomy. Number two, we have to give them belonging. They have to be part of a team. And number three, they have to have a cause they're working for. So if they feel a sense of autonomy in that they can make a decision and then understand that by struggling through an issue or toiling with the problem and overcoming it and feeling success, that leads to their personal satisfaction. If they can feel like they're part of a team, belonging, then they're going to feel like that community, right? That the fear of being ostracized or the fear of losing connectivity is more important than personal satisfaction. Peer-to-peer accountability is way stronger than manager-employee accountability. And if they all understand they're working for a group, like we have a community here, we're all trying to accomplish this mission together, your productivity will through the roof. But with each of those comes very specific deliverables that you have to make sure that your team is following in order to have autonomy, belonging, and a cause. It's the ABCs of leadership, as we say around here.
What was the most difficult aspect for you, either in and you can pick one. So was it
Sure.
about getting your head wrapped around something, or was it the implementation slash execution of something?
Oh, execution, right? Um, you can have all the vision in the world, but if you don't execute, it's just a dream. And so what there's two parts of execution, right? There's the system that you create to execute a vision, and then there's the mundane following up with the metrics and the measurables to make sure that execution is appropriate. And the hardest part as a physician is to understand that I don't heal patients alone, right? I grow people, I grow leaders, and they help me heal patients. I don't build a great patient experience. I build great people who build a great patient experience. And so as I turn over the reins to the individuals who are in middle management and they're kind of pulling the levers to make sure that we're implementing or executing the system that we've built, watching somebody struggle through that, watching somebody get better at that is one of the most difficult parts of leadership because physicians in general, and I see this all the time, are high functioning individuals who can rapidly solve problems. So you have to take a step back and understand that in this moment, The person is more important than the system. I'm building both at the same time. And that's very difficult as a physician to do.
I want to play the part of a cynic just because this exists. So I know that this person is listening right now
Mm-hmm.
and they're saying to themselves, that all sounds fine and good, but I
Mm-hmm.
just can't find good people right now.
Yeah.
What would you say to that person's either from a step to take, a shift in mindset? If you were just having a cup of coffee with someone who had that thought, what would you
Right.
say?
So people will surprise you is the number one thing I would say. If you will take a moment for yourself, complete this exercise first. What do you want to be about? What's your personal mission? What do you want to be known for as a provider? And then what do you want your practice to be known for? And those in employed practice and those in private practice can both take that exercise. Once you come up with that, communicate it to your people very clearly. Right off the bat, you're going to see the people that are excited about that and the people that are not excited about that. That's going to take, it's almost like sifting sand, right? You're mining for the people that have the same kind of attitudes you do. You are going to have turnover when you do that. You are going to lose people. I would submit to those people that would argue that's all fine and good, but I can't find great people. You may even find yourself at a deficit for a moment as you rebuild your team. And once you've kind of sifted, then you take that into your employment hiring process and you have those same conversations and you start to ask the questions, are these the type of people that will be a good fit for the team? And you have to really, really be intentional about hiring for culture over hiring for a specific skill set. And I get it. I have been in medicine now for over a decade, and I've seen hiring for out of necessity versus hiring out of culture. And almost always the time it takes to unravel a hiring decision because it was out of necessity and not out of culture is way longer than the time it takes to find that right person to put on the team and get them culturally bolstering the vision that you have. It doesn't seem that way intuitively, though. You think to yourself, oh, I can just hire this person and they're just going to get the culture. Well, that is more often not the case than waiting a couple extra months to find the right person to come on. And, a lot of times in our healthcare climate, we have to consider, is it that our pay needs to be more competitive than our competitors because we're trying to get different style talent? You'll get more out of your people if you hire the right people who want to work for you for the right reasons than you'll ever get for a normal waged employee who doesn't really care where they work.
Yeah. And I think there's that person may also feel a little stuck because maybe this feels like a stretch, like a big gap for them to cover between where they are today and where they are, where
Mhm.
we're talking about. And what I
Yeah,
would say to that person, especially if you have kids, think about the standards that are clear at home
right,
and how we interact with our children and our family. There are standards, there's things that are acceptable. We hold people accountable to that level of expectation. And it's because we care and love for them.
right.
So you're doing it.
Absolutely.
And you may just not have brought that over to your business because no one showed you that process, it's about build, like you built a community at home with standards and caring. You can take that, you've already done it. So this isn't as big of a stretch
Right.
as it may
Right.
feel like.
Yeah, I totally agree with you. It's about being intentional. Just like there's two things I definitely want to address in that statement. It's about being intentional. Like if you're raising a child, or you have a marital relationship, you're making deposits in that relationship and you're making withdrawals in that relationship, and you've got to be intentional. The same is true for your employees. I think a lot of times, and I see this in kind of corporate culture a lot, that taking the family ideology from the home and then applying it to business. Your family at home is a family. Your team at work is a team, much more like a sports team. Like every individual person has a contribution to make. I say a lot to our managers, I don't want this to sound cold, but we are not a family, we're a team. Because family, you work from the strength the family gives you. For your team, you work for the team. And so a lot of times it can be when you're walking this line as a provider, especially for those who are just starting in practice. If you're watching this and you're just starting in practice, I made this mistake and learned from my mistake. It can be really easy to label your business as we're a family. And you're going to be on culturally shaky ground because your team members will expect from you the same type of grace, affection, and support that your children would. And you cannot provide that as a leader effectively and lead a great team. You can be a great coach. You can be a Phil Jackson, right? You can really promote people to be the best versions of themselves, but trying to say that I'm going to be your dad isn't promise or shoes that you can't fill.
Yeah, and you don't want your adult, you're not going to turn away your adult child from coming sleeping on the couch at the
Exactly.
office. You have to. So,
Yes, exactly. Yeah.
um, so tell me about the origin of providerautonomy.com.
Yes.
This is really exciting that you're doing this.
So I came out of residency and I came out of medical school with just a ton of, like I said, ton of surgical training, but no leadership training. And so this website, we've broken it down into several different sections. The first section is our basics course. It's I think a 10-part free course that you can take, watch the videos, there's associated worksheets, and it really walks you through how to build a mission, how to build vision, how to have values on your team, how to meet your employees where they are, how to walk through what's the employee's personality, what are their strengths, what are their giftings, what's their emotional intelligence level, how do you speak to an employee, how do you evaluate an employee, how do you set up an office, how do you set up a billing system, how do you set up a management system, really the nuts and bolts of practice leadership to get you hungry for the understanding that if you can get through medical school and residency, you can run your business. I promise you. The other part of the website is a practice evaluator. We have a quiz that providers can take and just kind of get a good piece of feedback on what the strengths and weaknesses of their practice are currently and where they need to lean in. We also have what's called the Forward Developmental Curriculum. It's the word forward as an acronym, which spells out how to develop middle management, how to develop your leaders. And the final part is we do a teaching each week on specific things that we deal with culturally within our business here. So this week we were talking about how to give feedback effectively to employees where they feel empowered and that you're on their side. And those are free teachings that we have on the website. We have a lot of guest speakers on there that kind of contribute to that forum. So again, the whole purpose of that is so that providers can understand that they do and can have the skills necessary to run their own practice and really find a real sense of meaning in not only the medicine, but also the management of their practice.
There's a statement you hear all the time. You hear it from companies that deal with physicians. You hear it from physicians, and
Yeah.
it drives me nuts.
Oh, I know what you're going to say.
Because it's this assumed thing, which I think is silly as whatever, but doctors just aren't good business people.
Mm,
And what drives me nuts about that statement is how much time as a physician did you focus on learning the craft that you learned?
right. Hours,
What if that time
years.
was spent on business?
Right.
Like the idea that you're just not good at something is preposterous. And if you look at business is about diagnosing root cause of an issue and
Mm,
applying a known system to create the outcome you want to. It
yeah.
sounds a lot like medicine.
Hmm.
And so I don't know if you've heard people say those things to you, like, oh, doctors just aren't good business people, or if
Hmm.
that hits you similar to the way it hits me.
Yeah. I hear it all the time. And one of my life's missions is to like dismantle the phrase. Because I really truly believe that if you can get through medical school and residency, this is something you can figure out. And the great part about business is that in medicine, failure is honestly outside of residency really, really, really antithetical to medical culture, right? So we're so worried about malpractice. We're so worried about our patient experience. We're so worried about the negative aspects of failure as physicians that we take that ideology and we put it into business. But business specifically is predicated on small failures because you don't learn anything in business from success. You learn everything from the mistakes that you make. All of our cultural outcomes, all of the staff successes that we've had are from not getting it right the first time. And so if you take this ideology of I have to provide perfection into the medical practice, you're going to be disappointed. But it is truly rewarding. And I think, honestly, a huge opportunity for providers because we all go into medicine at some level searching for meaning. We want to connect with human beings. We want to make people feel better, right? How many people in their residency or medical school interview said the phrase, I want to help people? So here's a great list of patients to help when you're practicing. There's also all of these people that you're going to interact with, from employees to nurses to administrators, that you can really have true, authentic connection with from a business perspective, a developmental perspective, that will give you an unbelievable sense of meaning as a provider. And I truly believe that we have commandeered the term burnout, and that's really just a lack of meaning. Like we're going into medicine looking for meaning, and we're not finding it because we're treating the same conditions over and over and over again, and we're not taking the opportunity as providers to be the masters of our own destiny and find meaning in ways that we didn't think we could.
You see, you are a private practice. You've built a team that you're excited about. You could spend your days being very successful, enjoying that. What you're doing with providerautonomy.com, that's a lot of work. Why did you do it? What's the meaning
Yeah.
there for you?
Yeah. So I know it's an unbelievable feeling in my own life when I'm able to connect with employees, leaders, community, people in our community that are in leadership positions, to pour into them, to develop that next generation. So there's a big piece of me that wants to see other people experience that same level of meaning in their life. And honestly, from a patient care perspective, I believe that if the provider has the skills and the resources in their practice in order to run and make the decisions from a business perspective, like they're already making from a medical perspective, that's going to be the best for patient care.
That's great. Caleb, I really appreciate you taking the time and
Yeah.
joining us today. I think this is such an important topic, and I hope that people listening are witnessing, what you noticed something, you took action on it, and now you're sharing the word for them to participate. So I highly suggest the audience go to providerautonomy.com, take advantage of those free resources, if not only to just let you realize what's possible. Maybe you don't
Right.
dive into everything on day one, but just
Right.
go get a taste, and just see what's potentially outside of your current view in regards to your practice.
Yeah. Absolutely.
And also visit physiciangrowthaccelerator.com. There you can check your vitals, where we will actually break down maybe the parts of the system in your practice that are keeping you from achieving the goals that you want to achieve, because every system is perfectly designed to get the result it gets.